anyway, talk with Jan. Hope you're doing well. Bye-bye.
come over to the side of empathy and logic, in my opinion. So thank you so much for being that person to stand up. I'm gonna start off by, there was a woman who was supposed to come today, Ellie Spawn, and her car broke down. That's how grassroots this event is. She was driving here from South Dakota, and her car broke down. She couldn't make it. So she put a video of her speech online, and I'm just gonna read her speech for you. So this is on behalf of Ellie Spawn. She is an insurance employee. She works for the healthcare insurance industry, and she's a strong advocate for Medicare for All, and here's her story. Hi, I'm Ellie Spawn. I'm a co-founder of the National Progressive Party, and I'm also a licensed health insurance agent. I've literally been making my living by selling insurance on and off for over 25 years. And I'll have to admit that it can be a pretty good living when I'm able to work consistently enough to make that good living. You see, not only am I self-employed, I'm self-employed out of necessity. I have a chronic disease. Because of rheumatoid arthritis, I can't work nearly as much as I would like to, and when I'm feeling well enough, I don't dare work too much and make to cover my bills, let alone be able to afford private health insurance. Because of this, there are plenty of months where I've had to choose between paying for medications, and I take a lot of expensive prescriptions if you're a cash patient, or paying my rent. This last month was one of those months. I'm one of thousands of Americans who find themselves in the same position. Because it's critical for me to be able to take my medications and still have a roof over my head, I've had to cut way back on working so I could qualify for Medicaid in my state. In South Dakota, our last governor was too short-sighted and mean-spirited when the opportunity to receive federal funding was presented to expand Medicaid for over 45,000 working South Dakotans, and Medicaid didn't get expanded here. So now, when I work, it's mostly volunteer work, and I sell the occasional Medicare policy to be able to afford things like car insurance and school clothes for my kiddo. But if I make too much, I lose my medical coverage. I'm a health insurance agent. I make my meager living selling health insurance. Even I want Medicare for all. Woo, Ellie's Even people working for the health insurance industry want Medicare for all. 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 All right, up next. Are you ready, Johnathan? I don't see you. Are you ready? Come on up. Bring your kids with you. We have a dog over here that also supports Medicare for all. One of our speakers, Dr. Madeline Jacobs, MD, that's her dog, and she definitely supports Medicare for all. So up next we have former Representative Johnathan Singer to give the perspective, the legislative perspective of what's been done. And I feel his speech is going to show us that progress can definitely be made. There is hope for giving us Medicare for all. Johnathan Singer!
All right, thank you so much. And since my kids are behind me, you're going to have to let me know if they go one way or the other. All right. I'll look forward to the hand signals. So I'm former State House Representative Johnathan Singer, and I spent 8.5 years representing Niwot, Longmont, Lyons, and Allens Park here at the state capitol, and it is my honor to be here because of that. But I'm also a social worker who worked with at-risk youth and elders. I'm always happy when that's the thing that gets claps. And it was my responsibility to be at the Capitol because of the people that I served. But my story starts unlike many of you. I was 24, I was freshly out of school, I was working, helping kids. And even as a supervisor at a child care center, I made $9 an hour. I was kept below 40 hours a week so they wouldn't have to pay health care benefits. And you know what happens when you work in a child care center? You get sick. So, and you know what? When you get things like pink eye, you really can't hang out around kids. You want to keep your coworkers safe. You want to keep kids safe. It's virulent, it spreads. And so now I'm taking time off of work, and of course I don't have sick leave, so now I'm not making money. I'm living paycheck to paycheck. And but for a stroke of luck, but for the fact that I already knew somebody who was a nurse who could get me a prescription, I was back at work healthy within a week. It shouldn't have to be that hard. You shouldn't have to get lucky in the richest nation in the world. And so 4 years later, I helped organize for Barack Obama. We passed Obamacare. We made sure people like me when they were 24 could stay on their parents' insurance. Progress was made, and 4 years later, I decided I was going to run for the state house. So I'm there knocking on doors for my election now, and I run into an old high school friend of mine knocking on doors. Hadn't seen her in years. And I said, hey, I'm running for office. What's important to you? Johnathan, whatever you do, you've got to make sure that we keep Obamacare. Okay, well, what made that so important for you, right? Well, Johnathan, I was a child care worker. Oh, wow, me too. And I got cancer. Pancreatic cancer. And I lost my job. And I lost my insurance. And finally, the Mayo Clinic was able to provide the services that I needed to save my life, but I couldn't afford it, and my parents liquidated their retirement so I could get the health care that I needed. I want you to help make sure that never happens to somebody else ever again. We talk about enhanced Medicare for all, and some people call it socialism. Well, if that is socialism, what happened to my friend is the equivalent of a mugging with a ransom. Your money or your life. Your money or your kids' lives. Your financial security and future or your children's lives. That's not the kind of nation that we should be living in, and it doesn't have to be anymore. So when I got to the state capitol, we expanded healthcare to over 500,000 people through Obamacare. And after every Republican attempt to roll that back here in Colorado and in the United States of America, more states are joining Colorado. Even states like Utah understand that healthcare is a value, a right, not a luxury, but a necessity. That is the story that we need to tell people, because the journey is still, yeah, you can clap for that actually, that's okay. But the journey is long. Even now, even today, people who have health care still can't afford to see a doctor. They can't afford the co-pays. They can't afford the premiums. Sometimes they have insurance, sometimes they're off of insurance. And we know during a pandemic, you cannot afford to go off of your health care because the hospitals are full, and the likelihood that you'll get somebody else sick is even greater. This work is tiring. This work is hard. But as we know, even in the foundations of our own democracy, when our country was founded, it was only white landowners, white male landowners that could vote, right? And then 100 years later, we had abolitionists. And then almost another 100 years later, we had women's suffrage. If it wasn't for the people fighting for what they believed in ahead of us, we would not be where we are today. So in the Colorado legislature, what did we do other than just expanding healthcare? Just this year, after my term was up, we made sure that undocumented immigrants had access and affordability for reproductive health care. We passed a Colorado care plan that says insurance companies lower your rates, make it affordable, or we will create a public option here in Colorado. The journey is not over. We need to celebrate what we have done. We need to mourn our losses and let it steel ourselves so we can forge a new path forward where enhanced Medicare for all works for every person in our country. Our seniors, our kids, our working families, people with disabilities, our undocumented neighbors, everybody. If this pandemic... This is my kids giving me the hook now. If our pandemic has uncovered one thing, is that we are all responsible to each other. And so it is my solemn responsibility to all of you, even as my term is up in the state legislature, that I will join you in the streets, I will join you in the halls of the legislature, and we will march to Washington, D.C., and we will get what is owed to our citizens, to our community members, and our residents of the United States, because it is our solemn duty to follow in the steps of our forefathers and foremothers and make sure that enhanced Medicare for all is not just a dream, but a reality. Thank you all.
Thank you so much, Johnathan. That was great. Up next, we have Bev Wasserman, our public health nurse. She's a lovely speaker, and I found out today that she has a wonderful sense of humor as well. So come on up, Bev. Thank you so much for being here.
Hey, everybody. Thank you for coming out today. Give yourselves a round of applause. This is so important, and I love your sign, SOS USA. We are in trouble. If you didn't notice that during the pandemic, we are in trouble. We don't fund planning, we don't fund public health well enough, and we definitely don't pay for our residents to have adequate health care. So thank you all for supporting improved Medicare for all. I just want to share a few words with you today. Again, I'm a long-time public health nurse, almost 4 decades. I've seen a lot. I've watched patients suffer. I've watched them get well. I've watched babies being born, as is true of all of my healthcare colleagues. I see some of you out there in white coats today. So thank you for allowing us the privilege to care for you. It's our honor. It's our life's work. This is what we dedicate our lives to. We give up time with our family. We do all kinds of things to make sure our communities are healthy. We need that paid for so you can come in and access the health care, right? Am I right? Am I on the right track? Okay. Just making sure we're on the right track. Again, we are grateful. We know our frontline staff showed up when it was risky during this pandemic, when we didn't know if we could succumb to this disease as well. We saw that many of our community members waited and came to care late because we've sent the message that healthcare comes at a great cost, that you may lose your home, you may lose your job. That should not be the case. Am I right? Okay? We should not be trading our lives for healthcare, for medication. I've heard these stories throughout my career. This is not new. It is time to act. This pandemic was a wake-up call. And I want to give my condolences to any of you who've had loss during this time. We've lost so many of our communities through this pandemic. Again, we have to think about what else. There was the fact of treatment, but there was also that people are afraid to access health care. That is a problem. We need to change our priorities. SOS USA. SOS, we are calling for help. So again, I'm not only coming to you today as a nurse, but I'm a person who's experienced cancer. I had to access the very treatment we're talking about today. Even with insurance, my out-of-pocket costs were almost $10,000. Almost $10,000. Should I have to trade between longevity and having time with my family and paying medical bills? No. I know many of you have experienced the same thing. We just heard 2 stories, the same thing. These stories are common, they're not rare. So this is the problem, and this is why we need a program like Improved Medicare for All. Again, in public health, we know that prevention is key. Getting people diagnosed, getting people screened early, that's what a program like Medicare for All, where people aren't afraid to access testing and screening and care, that's going to make a difference in our outcomes. It's going to make a difference in our lives, our quality of life, right? Yes, yes. So lastly, I just want to say, and I can't leave today without saying this. First of all, I hope you all got your vaccine. I'm a public health nurse. I'm a public health nurse. I'll always speak to you about taking care of yourself. Take good care of yourself. Take care of your mental health. Okay? All of those things are important. Healthcare and housing are social justice issues. We see that, right? We saw this year, unfortunately, the history of racism pop up in this country. It's been there, but it's been quiet, but it became evident for the world to see, which in some ways is a good thing. It's a sad way for it to happen, but now we know it's there and we know we can do something about it. We're willing to work toward a more just, equitable society that serves all of us. Now, this is what Emma Lazarus wrote many years ago in the 1800s. You all know this little poem. And again, it was a poem of intention. I don't even know if she was inclusive of all of us in that poem, but we said, give me your tired, your poor, your huddled masses yearning to breathe free. Think about that after this year. The wretched refuse of your teeming shore. This is an intentional call that if we mean that, if that is a value in this country, we have to put our money where our mouth is. We spend a lot of money on a lot of things, and all of which are important, but what could be more important than our citizens living their healthiest lives, having the best opportunity to not only get a job, but be able to stay on the job because your health is managed, you've prevented disease, you're thriving. So that's why this is important for us today. Again, equitable services and care is providing what communities need to have the opportunity for the best health outcomes possible. Improved Medicare for All gives us a way forward to provide universal health care for all of our communities. And we want to call out and acknowledge that we are talking Black, Indigenous, people of color, immigrants, LGBTQ+, those living in poverty, especially generational poverty, those needing mental health and substance use treatment, to name a few. So I want to thank you for using your voice, use your power, use your privilege. If you may have more than you know, let's get Medicare for All passed around our nation. We are gathered around the nation today with the same call, and I want to thank you all so much. Be well.
Thank you so much, Bev. That was amazing. Up next, we have Jenn Bigham, who is a mother with a very powerful story about her lack of access to health care, her and her families. Give it up for Jenn! Woohoo!
Good morning, everyone. How are we doing? All right. Are we ready to make enough noise that the governor won't have a choice but to hear us this morning? Jenn. I'm a wife, mother, political science student here at the University of Colorado, Denver, former local government employee with the town of Castle Rock, and new content creator on a Facebook page entitled Jenn's Joy, where we take a look at the current political human rights issues of the day and try to break them down in a way that is more understandable for the everyday American, with Colorado's finest cannabis. All right, first of all, I want to start off by thanking our grassroots organizers like Marissa Russo and everyone that partnered with the March for Medicare for All. Y'all may not know it, but you are the reason families like mine have a voice in this country, so thank you. I was asked to be here today to tell my family's story, but before I get started, I want to recognize mine and my family's privilege over those of the global majority. I say this because the lack of health care impacts families and people of color on a greater scale than families and people that look like myself. Part of the reason I'm wearing this shirt today, Black is Essential, is to bring awareness to the web of issues even within Medicare for All. Black lives still matter, so please let us not forget that while we push for this issue. I'm really nervous, y'all, sorry. Okay, my family and I moved here during the summer of 2016 from a little town in Ohio called Madeline. We came here looking for a better life than what we had access to there. My husband found employment as a plumber, and I got my first big girl job with the town of Castle Rock. Now, as a full-time employee, I was privileged enough to have access to health insurance. Since these types of benefits are hard to come by in the trade industry, I was responsible for my family's needs. My insurance consisted of medical, dental, vision, and mental health. This covered my family of 5, including my oldest son, who is a full-time college student. I paid almost $400 per month on my portion of the premium. I had a $7,500 family deductible with $1,500 per person, I had co-pays and co-insurance all on the wage of less than $25 per hour. Again, I'm going to recognize my privilege here. Prior to the pandemic hitting, I had recently started suffering from persistent migraines. Anyone who has ever suffered from debilitating migraines understands the impact that they can cause in all aspects of your life, especially during that stage of finding the right medication. All right, so I was even utilizing my FMLA benefits entitled to me through important federal legislation. Then on March 13, 2020, the pandemic hit and we were all sent to work from home while simultaneously teaching our children through Zoom. Now I still have two school-age children at home. One has an IEP, which is an individualized education plan, and one who was in her sophomore year of high school. I was notified on September 4, 2020 that I was no longer employed with the town of Castle Rock. The thought of losing my job terrified me, but not because I lost my first big girl job, but because I lost health insurance for my family, and that was my job. Sorry. I still have tubes in my ears from 3 years ago. I can't afford to go get them removed or to even go get them looked at. I had a surgical procedure done at Castle Rock Adventist Hospital during the summer of 2018. I was so confused over who I owed money to, from the doctors to the anesthesiologists to the operating rooms to the hospital themselves. Every day being bombarded with bill after bill, having to contact each entity to find out why the insurance is not covering this item or that service. Then shortly after the pandemic hit, the hospital sued me for the balance of $2,200 that I had left to pay from my deductible. Sued me during the pandemic. Now here I am dealing with migraines. My teen daughter was utilizing the mental health portion of the benefits as somebody who battles with severe anxiety and depression. My husband over there, Ryan Stifler, shout out. My husband, 2 years. He was 2 years into a 4-year treatment plan with our local dentist to save his teeth because they were literally falling out of his head. And because everyone's insurance is tied to their employment, when I lost my job, we lost access to all those different healthcare plans. This led to us having to be a little bit creative with our own healthcare situation. Now we just pay out of pocket for my daughter's medication and therapy. I'm currently utilizing organizations like Planned Parenthood, but foregoing many tests and mammograms because I don't have the money to pay out of pocket for those tests. And my migraine medication. They're just too high of cost. And then we decided, let's make a trip to Mexico to have my husband's dental work done. So shout out to my friends with the contacts in Mexico and to Bernie Sanders with his idea to plan Canadian bus trips from Rhode Island just so his constituents could purchase pharmaceuticals at a highly discounted price. So it got Ryan and I thinking, what if we did this as a couple first, see how it goes, then start planning trips for others to have access to quality dental care? Our friends explained that their dentists were just like dentists in the US, except 80% cheaper. After getting the information and contacting the dental clinic in Mexico, we started to plan our first trip. We no longer had the privilege of saving his teeth. Multiple infections and rounds of antibiotics just to keep the infections at bay prompted us to react right away. So this spring, my husband and I documented our journey through my Jenn's joint outlet and showcased how we used most of our stimulus check, people. Most of my stimulus check went to Mexico. There you go. To have the remainder of his 23 teeth removed and fitted for his first pair of dentures at the age of 37. 37. False teeth. The process is still not over. He has a few more appointments left, but all in all, we are currently sitting at an 85% savings, and that's factoring in for travel, lodging, and food. In conclusion, to reiterate what Bernie Sanders has been saying and most true progressives since the 90s, there is no reason that in the richest country in this world, we have people suffering and dying, especially during a public health crisis, because they do not have access to health care, let alone quality health care. Healthcare should not be tied to your employment. It only sends the message that your life only has value if you are working. Business owners right here in Colorado just signed a petition to force Governor Polis to cut back on all unemployment benefits so it forces people back into the workplace. I suggest we look at healthcare being used as a negotiation tactic to pay people less than a living wage, knowing damn full well people will put up with just about anything for their healthcare. Business owners want employees, make Medicare for all a reality. Pay your workers a living wage, stop exploiting people's health issues to keep them in shitty work environments, and maybe you will see folks come back to the workplace. Solidarity forever. Healthcare is not a political issue. This is a human right. People, you've got to fight for that. Now let us all come together and work for this issue. Thank you very much.
Sharing your story. Up next we have Dr. Madeline Jacobs. She's a retired physician and she's going to give you her perspective on why her years being a physician has made her an advocate for Medicare for all. Thank you for being here, Maddie.
Hi everyone. So, I'm from Fremont County. I've lived down there for 30 years, so I'm originally a Florida. I was a country doctor for...
Mike! Closer to the mic.
Is this better?
Yeah.
I was a country doctor for 30 years. Actually, I was wondering if you could hear me, but thank you. I loved being a doctor. It was a privilege to heal, be with people at the most intense times of their lives, bringing new lives into the world, and easing others out at the end of their long journey. I was blessed to share the lives of multi-generational families, but the system became more and more twisted by forces beyond my control. Profiteers began denying my patients care or pricing it out of people's reach. Patients with treatable diseases were suffering and dying, and there was nothing I could do about it. I now know the names of this dilemma: moral distress and moral injury, something so pervasive among caretakers that more and more people are leaving their professions and committing suicide. We all have healthcare horror stories that you've been hearing up here. COVID simply magnified the underlying problems and inequities of an already dysfunctional system. At the height of the pandemic last year, millions of people lost their jobs and consequently their health coverage. They got sick, went bankrupt, and often died. So much for employment-based insurance. Just recently, a young woman in a car accident was afraid to take an ambulance because of the cost. She had insurance, but deductibles, co-pays, and surprise bills are so pervasive that she is justified in her fear. Another person just diagnosed with cancer set up her will rather than getting treatment as she knew she couldn't afford care. People resort to bake sales and GoFundMe in the hopes that a child's illness won't result in bankruptcy or the loss of a home. The American experience of denied and expensive care is uniquely horrific among the wealthy nations of the world. People often look at the promise of improved Medicare for all as a pipe dream. Yet, universal healthcare systems which cover everyone and cost less than half what Americans pay have been implemented all over the world, in countries big and small, rich and poor. Germany and Japan implemented theirs in the 19th century. Taiwan implemented a single-payer system in the 1990s under a conservative government. Truman proposed a single-payer system here in the 1940s. But corporations and those that profit from this fragmented system have suffocated reform. Today, perhaps the many will prevail. The majority of Americans support improved Medicare for all. The naysayers, including the partnership, the coalition of health insurance corporations, big pharma, and hospital corporations, have deep pockets and don't relinquish their profits easily. Just this past year, they showed their ability to blanket the airwaves and social media with their half-truths and lies. We must unite. We must show that this is a democracy of the people and for the people, and let our representatives know where we stand. For healthcare as a public good, we are human beings living in aging bodies that get sick and injured. We take for granted public services such as free public education, libraries, and fire and police protection. Quality healthcare should be guaranteed for all to live the fullest, healthiest lives we can without fear of financial ruin. We have the right to life, liberty, and the pursuit of happiness. We, the people, can do this. Stand up, march, contact your representatives. Join us and our many allies in getting this done. Social change can happen, but it's up to us.
Thank you so much, Dr. Madeline Jacobs. That was great. Our last guest speaker, his name is Ezra Halstead, and he is a youth activist and founder of, let me look at the title here, the Young People's Campaign for Universal Healthcare. So please welcome Ezra Halstead.
Alrighty, first of all, if you are under the age of 27, make some noise or raise your hand. Woo! Oh my gosh! Wait, you mean young people are affected by healthcare? I'm Ezra, I'm young, and I am talking about healthcare, and for some people that might be quite the conundrum. There's this idea that healthcare doesn't affect young people, which we're not invincible, just putting that out there. Unfortunately, like our criminal justice and voting system, our current profit-based healthcare is designed to kill and seriously disadvantage Black and brown folks, undocumented immigrants, disabled folks, those in poverty or lacking money, as well as so many other minorities. Young people inherited this system. We did not create it. We demand an equitable healthcare system free of discrimination. I'm standing here today for my trans brothers, sisters, and siblings who are constantly denied medically necessary, yes, medically necessary surgeries and hormones. I am here for people denied coverage by insurance because insurance companies believe mental health is not medically necessary since it costs too much money. I'm here for my sister and her best friend who in their 20s have had extenuous medical debt, tens of thousands of dollars in their 20s. I'm really lucky. I have a chronic health condition. I have a primary insurer through my mom's work, but a $3,500 annual copay is easily enough to seriously trouble a middle-class family. Thank God my family and I applied for Medicaid to help this financial burden. Note that we had the time, energy, and privilege to do so. Medicaid is such an important step to healthcare and a system that young people can be proud of. But why should people have to apply or qualify for a basic human right? While Medicare and Medicaid are important steps to a healthcare system everyone can really be proud of, it's not cutting it right now. Healthcare is a human right, and the solution to America's healthcare crisis is universal healthcare. Adults before us have had the inspiration from world-renowned countries and past presidents to create a universal healthcare system. When I was younger, I used to wonder what happens when a family member passes down a bunch of debt as a parting gift. The fact that that went through my head says something about the world young people grow up in. I used to think how horrible that would be, and yet here we are, the children of adults before us who have created a healthcare crisis. To our politicians, to our parents, to everyday people, we need a universal healthcare system so my children and future generations can be healthy and happy. It really is that simple.
expertise. Woo! Thank you for coming. So appreciative. Just want to give a shout out to all of our partners, because I could not have done this by myself. When I volunteered to do this, I had faith that there would be people like you that were ready to make a statement about this. I knew there would be people that would be willing to put the work in, and they definitely were. My main partner in crime was Sarah Wright. She's the communications director from Colorado Foundation for Universal Healthcare. So thank you to her and everybody from Colorado Foundation for Universal Healthcare. You were really my right-hand man in this for the most part. I also had Jason Rivera. He is from PNHP, Physicians for a National Health Program. Thank you so much, Jason. He was out there pounding the pavement, spreading the word about this, getting other people to partner, so thank you so much. Otherwise, we had I can't name every single person, but those were just off the top of my head. We also have Fort Collins, Fort Collins DSA, Let's Make the Break, PSL, Party for Socialism and Liberation, the Harm Reduction Action Center, our Vadens for Progressive Action, Healthcare for All. I'm going to start off with just a little chant from Let's Make the Break. They're actually using this to film a promotional video to promote Medicare for All. They're getting the funding. It's not going to compete with the private health insurers, but they are getting the funding to try to spread the word out there. So, Christine, is it just Let's Make the Break? Would you like to start us? Yeah. Okay. Christine. And then after that, I'll direct you where we're going to just march around the building a couple times and make our statement.
Thank you. We believe we're ready. We think the American people have been surveyed enough. We're ready. Let's make the break from corporate insurance that is not the answer. It is one person, one health care, not employment health care. Thank you very much. Let's make the break. 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 Let's make the break.
Thank you so much, Christine. Okay, I did want to just give one last shout out. He was already mentioned, but I would not be standing up here if Bernie Sanders did not speak out. Back in the mid-2000s, somewhere in there, or late 2010s or something, I came across something that he said. He articulated it with facts, and it was things that I had thought myself, but I just felt uninformed, and I never really articulated it in the way that he did, and I thought, wait a minute, is there really something to these views that I have? Other people feel like me, and that's when I started, and he said, change happens from the bottom up. People like me should be trying to be out there making a difference, running for office, things like that. I'm not saying I'm doing that, but just like we are it. You don't need to get your PhD in poli-science to know that you want Medicare for all. You don't need to get your PhD in economics to know that it's the logical solution, So keep speaking out confidently about this, and thank you to Bernie Sanders for giving me the courage and inspiring me to be involved and make a difference. So what we're gonna do is we're gonna make our way along this path because this is accessible with no stairs for anybody that is not gonna be walking. We're gonna be making our way just down here, and then we're gonna be on the sidewalk of the outskirts of the building. We'll head around a couple times, we'll do some chants. If you have a megaphone or if you have a chant you wanna start, you're welcome to. I have a megaphone, I can lead a bunch of them. And then there's also going to be a group. Maddie is going to be staying over here, or she's over here now, but she's going to be staying over here with the sound equipment. So if you do want to stay back with your signs and do some chants from over here because it's not comfortable for you to go around the building, then you're welcome to do that as well. Again, thank you so much for being here and supporting Medicare for All. It's so important, and it is a realistic goal that we all deserve.
Took a couple already, but if you want to pose. It's happening. There you go.
Okay, friends. If you're gonna tell an elementary school teacher. Friends. Okay, let's head down this way.
Everybody follow Marissa. She's starting the march.
Everybody in, nobody out.
Everybody in, nobody out.
Everybody in. Nobody out. That's good healthcare. All those out. Everybody in. Nobody out. That's good healthcare. All those out. What do we want? Medicare! When do we want it? Now! What do we want? Now! When do we want it? Now! What do we want? Medicare! When do we want it? Now! What do we want? Medicare! When do we want it? Now! What do we want? Medicare for all. When do we want it? Now! What do we want?
Single payer health care. Now!
What do we want? Medicare for all. When do we want it? Now! Everybody in. Everybody out. All out. Everybody in. Everybody out.
biggest single lesson from the pandemic is the only reason we are where we are, as good as we are, is because we make vaccines free to everybody. If we care about providing health care, we make it free. If we want people not to drop their everybody could get in for free. If we didn't want HIV, everybody could get married. We don't care.
Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. What do we want?
Medicare for all.
When do we want it?
Now. Medicare for all. Medicare for all. Now. Medicare for all. Now.
nobody else. That's what healthcare is all about. Everybody in, nobody out. That's what healthcare is all about. Medicare for all. 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 Medicare for all.
Hey, Jackson, stay over here though, buddy.
Health insurance only takes, let's make the break. 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 Health insurance only takes, let's make the break.
You having fun rolling? Right here. You want to do more rolling down the hill? Okay, you can still keep doing it. We were lucky it was a hand-me-down. Otherwise, this is like $1,000. I know, I could have bought the super.
That's great, though.
It is. This has been all over the country. It detaches. Spend another $1,000 to get from the other side. That might be actually cost effective. Or they can just grow out of it and walk on their own. Eventually. It'll happen. Come a long way too. So I mean, even in Colorado, think about 15 years ago, we were about 17% insured, now we're at 6%. That's, you know, not going to be sneezing that. Not where we need to be, but exactly. Thomas Jefferson said the price of democracy is much more visible. Right? Not just vigilance over the William, you're losing your pants, sir. You want me to tie your shorts? No? Okay, well, I guess that'll slow you down.
Medicare for all. Got to go!
you so much. You did great on your speech. You did great.
Thank you, Ezra. Yeah.
I have to get you a corporate sponsorship from Hall's Lozenges after you give me the chance for
Nobody else is here right now. We'll wait for the traffic cops. To save our voices. From the music to the voices by instrument.
Hi.
Hi.
What do we want? Single payer health care. When do we want it? Now. What do we want? Single payer health care. When do we want it? Now. What do we want? Single payer health care. When do we want it? Now. What do we want? Single payer everybody can hear me? It looks like the crowd is starting to disperse a little bit, and when you're ready, a couple of us are going to go get a drink or something somewhere around here, and you're all welcome to come. So if you would like to get in on that, just meet us up where the sound equipment was, like in that area, and then we'll decide where to go. So maybe we'll do a few more chants and then head up, or maybe we can just head up, I don't know. But thank you, either way, thank you so much for coming. I really appreciate all of you supporting Medicare for All. This is a great turnout.
Thank you, Marissa.
Thank you. Woo! Okay, let's do one more chant. Medicare for all. 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 Yay! Medicare for all. Thank you, Marissa. Thank you for coming. Woo-hoo.
think he must have gone up the hill.
All right. Well, keep the faith.
Yeah, no kidding. That's